Acyclovir, which also goes by the brand name Zovirax, is an antiviral medication which interferes with viral DNA synthesis. This medication is only effective during viral replication to treat conditions such as herpes simplex and varicella zoster viruses. Acyclovir treatment should be started as soon as possible or within 48 hours of the onset of symptoms. Acyclovir is available to be taken by mouth or in tablet form or as an oral suspension, IV and as a topical.
Acyclovir should not be used in patients with a history of hypersensitivity and used cautiously in patients with renal impairment, dehydration, and concurrent use with nephrotoxic medications. Acyclovir should be taken by mouth, IV, or buccal. This medication is categorized as a pregnancy risk B and pregnancy risk C if applied topically. Use while breastfeeding only if potential maternal benefit outweighs the risk. Dosage for older adults may be decreased due to age-related decrease in renal function. When lesions are present, no sexual activity should occur, and during sexual contact, condoms should be used.
Medications such as provenecin and theophylline can decrease elimination of acyclovir and increase the patient's risk for toxicity. Phenytoin can decrease the levels of acyclovir and reduce the effectiveness of the medication. Lastly, concurrent use with nephrotoxic drugs can increase the risk for nephrotoxicity. Patients should complete the prescribed course of therapy, even if manifestations resolve before completion. Acyclovir is not a cure and does not prevent the spread of the infection to others. When given intravenously, ensure medication is administered slowly over 1 hour.
When given by mouth, it can take up to 2 days for the drug to peak, and the duration can be up to 4 hours. It is important to continue medication all the way up to the end of therapy, because acyclovir can take up to 3 days to show any effects. When effects do take place, you will see crusting over and healing of the skin lesions, as well as decreased inflammation and pain. Mild discomfort has been noted with oral therapy usage. Patients commonly present with adverse effects such as nausea, vomiting, headache, and/or diarrhea.
Prevention of the varicella zoster infections and herpes simplex can start with getting your vaccines. You can get your first dose of the varicella vaccines at 12 to 15 months old. The vaccines, Varivax and Proquad, should be given subcutaneously in the outer aspect of the upper arm or the anterolateral thigh. The second dose can be given at 4 to 6 years old and through the same route. Parents should be aware to not give aspirin to treat the fevers after administering the vaccine due to the increased risk of Reye syndrome.
Adults who have never contracted chickenpox or have not been received the vaccine can get the varicella vaccine at any time. 2 doses of the vaccine should be given at least 4 weeks apart. When administering the vaccine, you should always monitor the patient for any signs or symptoms of anaphylactic shock in response to the vaccine. Some normal side effects of the vaccine include redness, edema, itching, headache, and tenderness at the injection site. The zoster vaccine is contraindicated in immune-suppressed patients and pregnancy.